What causes high blood pressure? High blood pressure, also known as hypertension, can be caused by a combination of factors. While the exact cause of hypertension is often unknown, several factors contribute to its development. Here are some common causes and risk factors. Genetics and family history. High blood pressure can run in families, suggesting a genetic predisposition to the condition. Certain genetic variations can make individuals more susceptible to developing hypertension. Age. Blood pressure tends to increase with age. This is primarily due to the stiffening of arteries and the natural aging process. Therefore, the risk of developing high blood pressure increases as people get older. Unhealthy lifestyle habits. Certain lifestyle factors significantly contribute to high blood pressure. These include poor diet. Consuming a diet high in sodium, salt, saturated fats, and cholesterol can raise blood pressure. Inadequate intake of fruits, vegetables, and whole grains, as well as excessive alcohol consumption, can also contribute to hypertension. Lack of physical activity. Leading a sedentary lifestyle without regular exercise can increase the risk of developing high blood pressure. Obesity. Being overweight or obese puts extra strain on the heart and blood vessels, leading to increased blood pressure. Tobacco use. Smoking and tobacco use can cause a temporary increase in blood pressure. Long-term tobacco use damages blood vessels and increases the risk of developing hypertension. Existing medical conditions. Certain underlying medical conditions can contribute to the development of high blood pressure. These may include kidney disease. Conditions such as chronic kidney disease or kidney abnormalities can affect blood pressure regulation. Hormonal disorders. Hormonal imbalances, such as an overactive thyroid gland, hyperthyroidism, or an adrenal gland disorder, Cushing syndrome, can contribute to hypertension. Sleep apnea. Obstructive sleep apnea, a disorder characterized by interrupted breathing during sleep, is associated with an increased risk of hypertension. Diabetes. Individuals with diabetes are more prone to developing high blood pressure, particularly if blood sugar levels are poorly controlled. Other conditions. Certain conditions, including certain cancers, pregnancy, gestational hypertension, and certain medications or substances, for example, oral contraceptives, nonsteroidal anti-inflammatory drugs, can also contribute to high blood pressure. Stress. While stress does not directly cause hypertension, chronic stress and unhealthy coping mechanisms, such as overeating, excessive alcohol consumption, or smoking, can contribute to elevated blood pressure levels. It's important to note that in many cases, high blood pressure develops due to a combination of multiple factors. Hypertension often does not cause noticeable symptoms, so it is essential to regularly monitor blood pressure and make lifestyle modifications as necessary. Treatment for high blood pressure may involve lifestyle changes, such as adopting a healthy diet, regular exercise, weight management, reducing sodium intake, and quitting smoking. Medications may also be prescribed to control blood pressure when lifestyle changes alone are insufficient. It is advisable to consult a healthcare professional for an accurate diagnosis, guidance, and appropriate management of high blood pressure.